Welcome to the Shigeki Podcast, where science and longevity come together to help you feel stronger and live longer, one wise decision at a time. I'm Dr. Mark Hyman, and with me today is my dear friend and colleague, Dr. Shigeki Hinohara, a man whose life and work have inspired generations to age with clarity and purpose. Now, let me start with a simple truth. We've all been told that vitamins are safe, right? That they're the key to protecting our hearts, our bones, and our brains as we age. But what if I told you that some vitamins, when taken the wrong way, could quietly increase your risk of stroke, especially after 60? I see this every day. Many older adults proudly show me their supplement trays lined with bottles of vitamin E, D, B, complex omega-3s, multivitamins, sometimes 4 to 6 different kinds every single day. They're doing their best, trying to stay healthy. But what they don't realize is that certain combinations, high doses, or even timing mistakes can backfire. Instead of protecting the heart, they may thicken the blood, raise blood pressure, or trigger dangerous imbalances that silently stress the body.
Yes, Mark. In traditional Japanese medicine, we have a saying, the right dose heals, the wrong dose harms. Supplementation is not about abundance, it's about precision. Vitamins can be powerful tools for longevity, but only when used wisely. After 60, the body becomes more sensitive, more selective. What worked in your 40s might now overload your system. Many people assume that if a little is good, more must be better. But the truth is, after 60, the margin for error narrows. That's why in Japan we focus on targeted nourishment, giving the body exactly what it needs, no more, no less.
And that's what today's episode is all about. We're going to uncover the 5 most common vitamins that could raise your risk of stroke, not because they're bad, but because they're often taken the wrong way, in the wrong amount, or at the wrong time. So, stay with us, take notes, and share this with someone you care about. If you or someone you love takes vitamins daily, don't miss this one. Remember to like, subscribe, and share this conversation. Might just save a life.
Now let's find out the truth we often overlook. Not all vitamins are harmless. The idea that you can't have too much of a good thing simply doesn't hold up in science. Especially after 60, our bodies change with age. The way we absorb, metabolize, and eliminate nutrients becomes slower and less efficient. What used to nourish us in our 40s can overload our systems in our 70s. When you're young, your liver and kidneys can easily filter out excess vitamins. But as you age, those organs lose efficiency. That means even normal doses can linger in the bloodstream longer, sometimes turning into toxic levels. For example, fat-soluble vitamins like A, D, E, and K don't leave the body quickly, they build up over time. In moderation, they protect your heart and brain. But in excess, they can thicken your blood, raise your blood pressure, or disturb your heart rhythm.
I've seen patients with fatigue dizziness and even chest pain caused not by illness but by supplement overload. The body becomes chemically unbalanced and blood flow. The very thing these vitamins were meant to support becomes compromised. And it's important to understand that the danger doesn't come from the vitamins themselves. The problem lies in the dose, the frequency, and the interaction with other medications. Older adults often take multiple prescriptions, blood thinners, blood pressure drugs, or cholesterol medications. When combined with high-dose vitamins, these interactions can quietly change how your blood clots or how your vessels respond to pressure.
We have 2 main types of stroke. The first is ischemic, caused by a blood clot that blocks flow to the brain. The second is hemorrhagic, caused by a burst blood vessel that leads to bleeding. Certain vitamins, especially those that alter clotting or vessel elasticity, can increase the risk of both. So when people tell me, "But doctor, I'm just taking vitamins," I remind them vitamins are active compounds. They affect chemistry, hormones, and circulation just like any drug. And when your metabolism slows with age, those effects become magnified. That's why understanding the science behind your supplements isn't optional, it's essential for staying safe and strong after 60.
Now that we understand why even healthy vitamins can become risky after 60, Let's get specific because some of them can raise your stroke risk almost overnight if you're not careful. Let's start with the first and perhaps most misunderstood vitamin on our list, called vitamin E. For decades, it's been marketed as the heart protector. You've probably seen it in antioxidant supplements promising smoother skin, sharper memory, and stronger arteries. But here's what many people don't realize when taken in high doses, especially above 400 IU a day. Vitamin E can actually make your blood too thin.
That's right. While a small amount of vitamin E helps prevent dangerous clots, too much can push the body in the opposite direction. It interferes with platelet aggregation, the process that helps your blood cells stick together to seal small vessel injuries. When that process is suppressed, even a tiny tear in a vessel can lead to excessive bleeding in the brain that can mean a hemorrhagic stroke, a silent danger that builds slowly without any pain until it's too late. And the risk multiplies when vitamin E is combined with other blood-thinning agents. Many older adults take aspirin fish oil or omega-3 capsules daily. When you add high-dose vitamin E on top, it becomes a triple hit to your clotting system. Your blood becomes too fluid, your vessels more fragile.
Clinical trials in older adults have confirmed this concern. In several large studies, people over 60 taking more than 400 IU of synthetic vitamin E showed a 13 to 15% higher risk of brain bleeding. These weren't rare freak cases, they were statistically significant increases that persisted even after adjusting for lifestyle factors. That's why context matters so much. The body doesn't need megadoses to thrive. In fact, the ideal range for most adults is closer to 150 to 200 IU per day, sometimes even less depending on diet. And whenever possible, vitamin E should come from real food, not pills.
So, you can find natural vitamin E in sunflower seeds, almonds, spinach, olive oil, and avocado. These foods provide the vitamin in a balanced matrix of fats, antioxidants, and minerals that the body recognizes and regulates naturally. When it comes from food, the absorption is gradual and self-limiting. Your body takes what it needs and leaves the rest. If you use supplements, it can flood the system, but nature never does that. The wisdom of aging is learning moderation, knowing that more is not always better. For seniors, the safest path is to nourish the body gently, not overwhelm it. So if you're taking a vitamin E supplement, check the label tonight. Make sure the dose is sensible and that it's truly serving your health, not silently increasing your risk.
The next one might surprise you, vitamin B6. It's often called the energy vitamin, and for good reason. It supports nerve health, metabolism, and even mood regulation. But here's what few people realize, that when taken in high doses, especially more than 50 milligrams a day for long periods, vitamin B6 can slowly damage your nervous system instead of helping it. I've seen many patients come to me complaining of tingling hands, dizziness, or irregular blood pressure. They think it's aging or poor circulation, but when we dig deeper, the real cause turns out to be vitamin B6 overload. Unlike water-soluble vitamins that flush out easily, excess B6 can linger in tissues, particularly in the nervous system, and interfere with the delicate signals between your brain and body.
Yes, and that's where the danger begins. The toxicity of B6 doesn't show up overnight. It builds quietly over months or even years. High doses can damage the myelin sheath, the protective covering around your nerves. Without that insulation, nerve signals misfire, leading to unstable blood pressure, irregular heart rhythms, and even reduced blood flow to the brain. Over time, that can increase the risk of ischemic stroke, where certain parts of the brain don't receive enough oxygen. In Japan, I've seen seniors who take daily multivitamins or B-complex capsules with 60, 80, or even 100 milligrams of B6, thinking it's harmless because it's just a vitamin. But what they don't know is that this constant accumulation can overwhelm the nervous system. Once those symptoms appear, numb, fingers balance issues, or brain fog, recovery can take months.
And the tricky part is that many people don't even realize how much they're getting. B6 hides inside energy drinks, protein shakes, fortified cereals, and even some sleep supplements. When all of that stacks up, it's easy to cross the safe limit without noticing. The truth is, your body doesn't need that much. Most adults only require around 1.5 to 2 milligrams per day, and even therapeutic doses shouldn't exceed 20 to 30 milligrams daily unless prescribed by a doctor for a specific condition.
Exactly. Instead of chasing high doses, focus on food. You can get natural balanced B6 from salmon, tuna, bananas, oats, and chickpeas. These foods provide just enough to keep your nerves strong and your circulation steady without the risks of overload. So before you reach for that extra B complex pill, remember, when it comes to your brain and blood flow, precision matters more than quantity.
Okay, let's talk about one of the most beloved supplements of all, vitamin D. It's called the sunshine vitamin because it helps strengthen bones, boost immunity, and even lift mood. But in the past few years, I've noticed a trend that worries me deeply. Many older adults are taking massive doses of vitamin D, 5,000, 10,000, sometimes even 20,000 IU per day, thinking that if a little is good, more must be better. Unfortunately, the opposite is true. High-dose vitamin D can quietly raise your calcium levels in the blood, a condition called hypercalcemia. When calcium levels stay elevated for too long, that excess calcium doesn't go to your bones. Where you want it, it starts depositing into your arteries. Over time, those calcium deposits make your blood vessels stiff and inflexible. This process, called vascular calcification, reduces elasticity, raises blood pressure, and dramatically increases your risk of stroke.
Yes, and it's especially dangerous for people who already have heart or kidney problems. The older the body becomes, the more delicate the balance between minerals and hormones that regulate calcium. Vitamin D helps the gut absorb calcium, but if magnesium or vitamin K2 levels are low, which is very common in seniors, that calcium can't be properly guided into the bones. Instead, it drifts into soft tissues and arteries. In my clinical experience, I've seen older patients proudly show me their blood test results, with very high vitamin D levels, believing they've done something good. But then their arteries become stiffer, their blood pressure climbs, and their risk of stroke quietly grows. The irony is that what started as an effort to protect bone health ends up hurting the very circulation that keeps the brain alive.
That's why I always remind my patients vitamin D works in harmony with other nutrients. You can't just take it alone and expect balance. If you supplement with vitamin D, you must also check your magnesium and vitamin K2 levels. Magnesium helps activate vitamin D and keeps calcium soluble, while vitamin K2 directs calcium into your bones instead of your arteries. And moderation is key. For most adults, a daily dose between 1,000 and 2,000 IU is enough unless your doctor prescribes otherwise. The goal is not to flood the body, but to maintain optimal blood levels, typically between 30 to 50 nangi per womesilo. So before taking another drop or pill of vitamin D3, get tested. Balance it with magnesium and K2 and never assume more is better, because when your arteries harden, the risk of stroke doesn't wait for a warning.
Let's move on to one of the most common supplements among seniors, calcium tablets. For decades, people have been told that calcium equals strong bones. Doctors prescribed it, ads promoted it, and many older adults still take large tablets every morning, usually 1,000 to 1,200 milligrams per day. But the problem is, when calcium comes from pills rather than food, your body often doesn't know what to do with the excess. Instead of going straight to your bones, the unused calcium can circulate in the bloodstream, and when your levels of magnesium or vitamin K2 are low, which is very common after 60, that calcium has nowhere safe to settle. Over time, it starts depositing in the walls of your arteries. That process, called vascular calcification, makes the arteries stiff and narrow, raising blood pressure and ultimately increasing your risk of stroke.
Yes, and this is something we've observed in many older patients, especially postmenopausal women. They take calcium faithfully, believing it protects them from osteoporosis, yet their cardiovascular scans reveal the opposite: hardening arteries and higher stroke risk. Several studies have confirmed this pattern. Women who take high-dose calcium supplements without balancing nutrients like K2 and magnesium have significantly higher rates of heart attack and stroke compared to those who rely on dietary calcium from foods like leafy greens, sardines, or yogurt.
That's the key distinction. Supplemental calcium is not the same as food calcium. When you eat calcium-rich foods, it's absorbed gradually along with other minerals and cofactors that guide it into your bones. But when you swallow a large tablet, you create a sudden spike in blood calcium that your body can't fully manage. Think of it like pouring too much cement into a mold. It overflows into places it doesn't belong. And that overflow can literally turn your arteries into stone. It's not the calcium itself that's bad. It's the imbalance. Calcium needs partners. Vitamin K2, particularly the MK7 form, directs it into the skeleton, and magnesium ensures it stays soluble and prevents crystal buildup in the vessels. Without those nutrients, calcium becomes a slow, silent threat to both the heart and brain.
That's why my advice is simple: never take calcium alone. Always confirm with a blood test that you're truly deficient, and if you need supplementation, pair it with vitamin K2, MK7, and magnesium. And even better, try to meet your calcium needs naturally through foods like salmon with bones, almonds, kale, or chia seeds. Because strong bones mean little if your arteries turn rigid. The goal isn't just to add calcium, it's to keep it flowing to the right place: your bones, not your bloodstream.
Finally, let's talk about a supplement that many people still take without realizing the danger: iron. For years, iron has been linked with energy, vitality, and better circulation. But after 60, especially for men and postmenopausal women, excess iron can quietly do the opposite. It can damage your blood vessels and increase your risk of stroke. Here's why. When you're young and still losing blood through menstruation or growth, your body naturally regulates iron levels by using or expelling the excess. But after menopause, or in men who rarely lose iron, those levels can start to accumulate over time. When that happens, free iron in the blood acts like a spark in dry grass. It triggers oxidative stress that damages cells from the inside out.
Yes, and this oxidative stress is not a small issue. Free iron participates in what's called the Fenton reaction, a chemical process that generates harmful free radicals. These unstable molecules attack the lining of your arteries known as the endothelium. Once the endothelium is injured, it becomes sticky and inflamed, attracting cholesterol and clotting factors. Gradually, that leads to plaque formation, and in severe cases, blood clots that can block circulation to the brain, the perfect setup for an ischemic stroke. I've seen many patients who take multivitamins that automatically include iron, even though they don't need it. Over time, their ferritin levels rise quietly, and they begin to show signs of fatigue, headaches, or joint pain. They think it's aging, but their blood is simply too heavy with stored iron.
That's such an important point. Unlike other minerals, iron isn't easily excreted from the body. It builds up. That's why I always caution my patients: never take iron unless your doctor confirms a deficiency. The only people who usually need supplementation are those with diagnosed iron deficiency anemia, confirmed through lab tests like ferritin and hemoglobin. For everyone else, food is the safest and smartest source. You can get plenty of iron from lean meats, spinach, lentils, and pumpkin seeds, and you can boost absorption naturally by pairing them with foods rich in vitamin C like oranges, tomatoes, or bell peppers.
Exactly. Nature provides iron in a balanced form alongside antioxidants that protect your vessels. Supplements, however, deliver it in isolation, which can tip the balance toward damage. So before reaching for that extra strength multivitamin with iron, check your labs. Because sometimes what you think gives you strength may actually be weighing your arteries down.
So after hearing all of this, many people ask me, "Doctor, does that mean I should stop taking vitamins altogether?" And my answer is no, you don't have to stop. You just have to be smarter about it. The truth is, our bodies were never designed to handle massive doses of isolated vitamins from pills. We evolved to get nutrients from food, from things that grow, swim, and live in nature, not from plastic bottles on the kitchen counter. When you eat real food, the vitamins come in harmony. They're surrounded by enzymes, fiber, healthy fats, and minerals that help your body absorb exactly what it needs. A capsule can't do that. The body understands nutrients in their natural form, but it struggles when they come in mega doses, especially after 60, when your liver and kidneys are already working harder to filter everything you take in. That's why too many pills can overload your system and even interfere with your medications for blood pressure, cholesterol, or the heart.
I completely agree. In my experience, the key to longevity isn't more pills, it's better food. Many older adults think vitamins are a shortcut to health, but the truth is food already gives us everything we need just in the right amounts. When nutrients arrive through food, the body knows how to use them. When they arrive as a flood from supplements, the system gets confused. I often tell my patients that eating a balanced meal is far safer and more effective than swallowing a handful of capsules. For example, a simple breakfast of eggs and avocado already gives your body vitamin D, choline, vitamin E, and good fats for the heart. Add a few blueberries and you've got antioxidants to protect your brain. A small handful of walnuts provides magnesium and omega-3s for your nerves. Leafy greens bring in vitamin K for your bones and circulation. And if you include fish like salmon once or twice a week, you're already covering vitamin D, B12, and omega-3s, all in the form your body actually recognizes.
That's such an important shift in mindset from quantity to quality. I often ask my patients to open their supplement cabinet and really look. Are the doses too high? Are there duplicates across products? Sometimes they're shocked to realize they've been taking 2 or 3 pills with the same ingredient. The solution isn't to fear vitamins, it's to use them wisely. Eat well, check your labels, and always talk to your doctor if you're taking more than a couple of supplements a day. Because in the end, the best supplement for people over 60 is still a colorful, balanced plate. Real food nourishes your body safely, gently, and sustainably every single day.
To wrap up, even vitamins have a dark side, but only when you take them without awareness. After 60, your body changes, your metabolism slows, and your organs work differently than they used to. That's why guessing or copying what someone else takes can be risky. The smart move is to personalize your plan. Get a blood test once or twice a year, talk to your doctor, and understand what your body truly needs before adding another pill to your routine.
I couldn't agree more, Mark. Too much of a good thing can become a silent killer. The key isn't taking more, it's taking right. Right vitamin, right person, right timing. Health after 60 is not about chasing trends or miracle supplements. It's about balance, precision, and gentle consistency. Listen to your body, it's wiser than any advertisement.
So, before you reach for that next bottle, pause and think. Ask yourself if it's helping, or just habit. Share this episode with someone you love who takes vitamins every day. Comment below, have you used any of the 5 vitamins we discussed? And don't forget to like, subscribe, and join us next time for the best vitamins to protect your brain after 60.